Have you ever tried to lift your arm and it just won't go anywhere? No matter how hard you push, you might be dealing with frozen shoulder. Frozen shoulder, or what's actually called medically adhesive capsulitis, is a frustrating and often misunderstood condition. It can get confused with a lot of other types of shoulder issues. So I want to make sure that we define what it is and what it isn't, and what other kinds of things you may or may not be dealing with, and also then how we might deal with frozen shoulder itself, and also some of the related issues you might be dealing with. So I'm going to start sort of way at the very, very basics of like, what the heck is the shoulder and how can we look at it, and kind of work from there. Right, so very, very basics, looking from this book right here. We think, the layperson, of the shoulder is just this general area, right? But the very first distinction I want to make is that the shoulder is really made up of 3 different bones and 2 different joints. Well, 2 different main joints, let's say. You've got the scapula, which is the shoulder blade, and the clavicle, which is the collarbone. That is called the shoulder girdle, which is any movement like this. Basically, the placement of the shoulder blade on the rib cage. That is very distinct from the shoulder joint, which is the humerus bone, or the upper arm bone, in the scapula, i.e. the ball and socket joint. And any movement of that ball in the socket itself, and that may not have any movement of the girdle. And so you can move the shoulder joint like this without moving the girdle. You can move the girdle like this without moving the joint, or you can move both together. And having those distinctions can make a really big difference, right? Medically, adhesive capsulitis, and when we talk about the capsule, what we're really talking about is that ball and socket, and there's a capsule that encapsulates the ball around the socket to keep it fused together, and that creates the joint capsule. Adhesive capsulitis basically means there's no movement allowed for the shoulder joint, irrespective of the shoulder girdle. And so you might be able to do these kinds of movements, but have none of these available to you. So that's some basics. Let's get a little deeper on that. So the girdle has protraction or retraction. It has elevation or depression, if we want to get super technical. And so those are all things available. It also has the ability to rotate in space. The shoulder joint, the humerus in the ball and socket, has the ability to spin. And so you have 3 movements. You have the ability to shift forward and back. You have the ability to rock this way, so this movement, or you have the ability to spin in there, or this movement. And so all 3 of those are available for the shoulder joint. When you have frozen shoulder, all 3 of those are generally completely limited or not available at all. And I've seen really advanced cases where somebody is basically stuck with their arm purely down in gravity, can't move it in this direction, that direction, or any of the 3 directions. In fact, I have a very recent client I've been working with that walked in unable to move in all 3, and we basically had to start with trying to regain movement in one of those planes, and then add a second one, and then finally add the 3rd one. And slowly but surely now she's got, let's say, 60% motion in one of those planes, 80% in another, and like 30% in one of them. And eventually she might get it all back. But she started out with like 10% movement in each of them, which, as you can guess, would be highly debilitating. If you can't literally grab a cup of coffee, or raise your arm to put your arm into your shirt, or answer the phone, or any number of things, that can be very difficult to go about your day and have life. What makes frozen shoulder even more kind of awful is that it's not even so much It's like past the point where it's painful. Usually what happens with frozen shoulder is you've had pain and you've been ignoring it for whatever reason. And your body just goes into lockdown mode and is basically like, I'm sorry, you're not allowed to be, you're just not allowed to use that anymore. You don't seem to be responsible about your life. You've continued to overuse this thing and not go do therapy for it, or take breaks, or take time off from the activity that's causing pain in the first place. So we're just gonna shut it all down and lock it in place and not let you move it at all, which is generally the thing that finally gets somebody to go to the hospital, go to the doctor, get a diagnosis. Now, from a medical perspective, the first treatment is often gonna be something like a cortisone shot, and that will sometimes generally provides enough relief to start to be able to move a little bit in those 3 planes, and the physical therapy will then help start that process and get it moving. I will say, if it's all the way to the point of adhesive capsulitis or frozen shoulder, you're definitely going to need a combination of physical therapy and other forms. Like, I can do a lot to restore the range of motion for frozen shoulder, but if you don't then do a bunch of physical therapy to lock in those gains, it's gonna freeze right back up again. And in fact, really early on in my career, I made the mistake once of working with somebody with pretty advanced frozen shoulder, and I did this session where they walked in barely moving and they walked out being like, oh my God, this is amazing. And within a few hours, it froze right back up again, and it was worse because then they were in a lot of pain and frozen. And so I had to learn how to like go a little bit more gradually with this and work with the physical therapy and go a little bit more slowly at first, and then ramp up as things stabilized and got easier for the client to manage it. But that's the basics of what it is. It can be a really tough condition to work on. It generally will take weeks to months to improve. It is one of those things where I would say, see me 3 to 5 times and a physical therapist 12 to 16 times is the kind of treatment protocol you're really looking at. But let's get into it a little bit more. So we have this picture here of, this is the shoulder joint, this movement, and actually, fun fact, the shoulder itself and the shoulder girdle is only truly attached to the rest of the skeleton right here at the clavicle to the sternum joint. Yes, there is a ligament that actually attaches the ribs to the scapula, but it's this really long, stretchy ligament that doesn't really provide, it's not like a true ligament joint like we think of, like holding bones together. Whereas here at the clavicle sternal joint, that is what we think of as a normal joint. Okay. So let's go through here a little bit more, and we can sort of see here that they're talking about some of these movements. Let's talk a little bit about some muscles here. So here you start to get the sense of how complex the musculature controlling these 2 joint movements really is. And one of the things about the shoulder that makes it really tough once it gets injured to this level is that it's actually a highly vulnerable structure, right? It is a very, unlike some of the joints in the body, it is largely held together by muscles, not so much by ligaments. And just to clarify, ligaments are very dense and strong. Tendons are less dense, but still stronger than muscle. Muscles are less dense and more movable, right? And so the shoulder is mostly tendons and muscle holding it together, not as many ligaments, unlike some other places in the body. And so it is much more vulnerable to injury. That has pros and cons, right? It has much more movement available to it than many other places in the body. And so that's the upside of not having all those dense ligaments holding things together tightly. Downside, though, is that it can be injured a lot more easily. And then once it is, it takes a lot longer for it to kind of tighten up and get strong again. And here we really, again, can see just how complex the musculature is that controls the movements of the shoulder. So, some things that feel like frozen shoulder that aren't. So you may have a, let's say, tear of the rotator cuff. And the rotator cuff is this set of 4 muscles. These are 3 of them here that basically control that movement, right? That generally will mean that you have very limited range this way, but might still be able to do things like this. Although that limited range in this direction may still protect you and prevent you from doing other movements, it's still a lot easier to restore that. You're not limited in all 3 sets of movements. You may have something like biceps tendinitis or coracobrachialis tear. That again can be quite painful and awful, but it's just a very different thing than true frozen shoulder, and can be quicker and a much quicker recovery, depends on how, whether the tendon itself is torn or not. I'm just sort of paging through here again so that you get an idea of just how much is involved in controlling your shoulder and how much can go right and how much can go wrong. Again, that rotator cuff, just to give you an idea, is this set of 4 muscles. So you've got 3 muscles here that do external rotation, and this muscle that's between the shoulder blade and your ribs that does internal rotation. When we're working with frozen shoulder, really what we need to do is slowly but surely restore all 3 of those types of movements. And so sometimes with clients like this one that I've been working with recently, I will spend some time generally having them work on a range only in one of those 3. This would be on the rotation range, and just do some work in this area, do some release work on the muscles first, then try to get the capsule to be comfortable moving, and then let it rest a little bit. And then we might switch to a different plane, either in the same session, or sometimes that might be enough for one session and we move on to a different body part. And then we come back and we work on a different set of muscles for the different next session. And then finally, we might work on a totally different part of that whole thing in the 3rd session, and then cycle back around. I think with this particular client, it took us about 6 to 8 sessions to get to the point where she was no longer in serious pain every single time that we worked on her, and also could really comfortably do things like put shirts on and reach for things in shelves and stuff. And she still had a long way to go before she could fully go up here. But when I met her, she couldn't even get her humerus, let's say, so normally it was hanging here. She could maybe get it to about here. By the time that we continued working together, she could get it to about here. The other arm could go all the way up. And then I gave her more work. And then hopefully within the next few months, she'll get both of them equal again. That is very likely to be a thing that she can do, but that will take more time for her. Let's talk a little bit about what can cause this. Frozen shoulder itself is not always, but in general, more of a longer term wear and tear, repetitive stress injury than it is a impact injury. Rotator cuff tear can be that, but it's sometimes like you slip on the ice, put your arm out, and your arm gets ripped back and you tear something, right? That's like more of an impact injury. Maybe that happens to you and then you ignore it and you slowly try to just deal with it, and then over time everything else freezes up and it becomes frozen shoulder. That's certainly a possibility. But in general, frozen shoulder sort of is a thing where you've got one pain condition that you're ignoring and you're just kind of toughing it out and not really dealing with it. And then slowly but surely over time, sometimes months, sometimes years, your body just shuts the whole area down and eventually just doesn't let you move it at all. So let's talk a little bit. There is, in medical terms, there's sort of 3 phases that they talk about with frozen shoulder. What I was just describing is the freezing phase, where you're increasing pain and stiffness over time until you hit the frozen phase, which is where you might not have as much pain, but you can't move much at all. And then we work on the thawing phase, where we're slowly but surely reintroducing movement, and we're getting there without as much pain. It's more like, can we get levels of discomfort that are tolerable with movement and keep moving through that until the range of motion gets bigger and bigger and bigger, and then give the client lots of homework. One big concept with this and any condition like this is that no matter what, you have to do your daily homework. And quite frankly, multiple times a day homework. You're gonna get way more out of just doing this 10 times a day than coming to see me once a week, quite frankly. Now, if you see me once a week and do that, then great, you're gonna go way faster. But if you're not doing that daily flushing of the tissue and getting it to move, it's gonna lock right up again, and then you're gonna have to start over again and start from scratch. And so the goal with any of this kind of, especially with frozen shoulder, but really any kind of like injury rehab, is to keep it moving, because that's how your body gets blood into the area, which is gonna help heal it, draw out all the broken tissue, bring in healthy tissue, and start the process of rebuilding it and getting it back to normal. And that just has to be a continual process of light but tolerable movement, and then to give it a break, light but tolerable movement, give it a break, over and over and over throughout the day. So that's just one thing to really keep in mind, that no matter what, whether you see me, whether you work with a physical therapist, preferably do both, that no matter who you're working with, if you don't actually do the homework that they give you, you're not gonna get anywhere fast. You might get somewhere, but it's gonna be really slow. That's a big overview on frozen shoulder itself. We did a little bit of tangential side view on some other conditions that maybe sound like frozen shoulder but aren't, but are also highly treatable by the work we do. If you're in New York City and dealing with any of these issues at all, we'd love to work with you. Come on in, book a session. We absolutely can help you, and have a great day.